started the training. We use in UK a surgical course like a boot camp. It's a very intense, get you oriented and ready to start your urology journey rather than being surprised. It's a combination of soft skills and hands-on skills. So I'm at the moment, Justin has just finished her tenure as the JS in charge of president. Another colleague has started. So as I was telling you about Abid Farooq journey, he graduated and then he did his training. He completed his training as a urology trainee like many of you guys. So you can see the timeline. Now around that time, he was very passionate and good and knows his abilities and his limitation. As we are aware in Ireland, if you have done your English proficiency, you are eligible to get registration. You don't need PLAB or an exam. So he has his MRCS and he applied there and got there a job in Drogheda, which is very close to Dublin. And over there, he was working for almost 4 years. Then he contacted me. I'm very much visible through Apna, Facebook, and I'm very proactive in helping and discussing the thing. So he contacted me. I said, okay, in Ireland, the probability of you getting a training number is almost zero. Nothing is zero, as we know. So I suggested apply. Potentially jobs will be coming, and I'll try my best to facilitate. He applied, and he joined a unit, and he started working with me. I sat with him and said, look, what do you want? Do you want to have your life in the UK as a specialist, or you want to challenge yourself, get into the training course and see? He said, Sheikh, I'll go for it. So I said, at this CV, you will not get a job as a training course because you're lacking, which most of us, when come from Pakistan, lack, and unfortunately, things not have changed yet. So as I was mentioning about timeline, if you can look at it, graduated in 2011, and he got his ST number in his second term. First time, he was not even shortlisted. So that's something, if you are good, you're hardworking, you're honest, you can achieve. Now, why we choose UK or Ireland? There are multiple reasons. Close to home. We all have a baggage. We want to visit Pakistan because of family reasons and so forth. Financially, it's good. You won't make as much money in UK most of the time as compared to America, Middle East, or Canada. But money is not everything, isn't it? This is what you have to decide for yourself. Quality of life is reasonable. UK is very multicultural, acceptance is better. There are regions where you move, you look like you're living in Pakistan. There are some areas and cities in UK, not only some cities. So this is the attraction for UK being the attraction for us as an international medical graduate. And I'm among you guys, so that's why I can relate with you. So all my urology training was in Ireland and UK. I never worked in urology, but I was very strongly affiliated with SIUT, Adeep Saab and everyone, and that was my inspiration. So if you look at the UK pathway, there are two pathways. One start is a junior level. Saqib has done an excellent presentation. I won't discuss about further. One is a standard start from the very junior level to the PLABs. Second is you're getting the equivalence based on your postgraduate qualification, doing the MRCS, or if you are medical, do the MRCP. MTI route, I have some reservation and very vocal about it, and the portfolio route. We should provide opportunities, and you guys should decide what is right for you. Our role should be as seniors to guide you through and facilitate the process. No one among us can give you the guarantee of anything. It's your hard work and consistently will succeed. If I'm getting bored, tell me, I'll stop it, and we have an interactive session. So acceptable post-qualification. In this era, I don't need to tell you. You can Google and find what's available. No one will going to spoon feed you. You have to work for it. It applies everywhere. So now I talk about this MTI initiative. Sounds very good on paper, in my opinion, or as a shortcut, it could be a good one. Anyone who is an international medical graduate who works they want to train him or herself, they can apply through the structured pathway, they get the skills and knowledge, expose themselves to the NHS culture, and they are aimed to go back after serving for 2 years. That's the condition. However, most of the people do not return. That's a reality because of the different challenges and circumstances. So there is a process. CPSP has been playing a role, but that's the main idea about it. So now I talk about the routes to become a specialist in UK or Ireland, and I will focus on UK at the moment. There's a standard training pathway and there's an alternate pathway. So if you look at the UK training pathway, once you have graduated, you will do your foundation years, as Saki has alluded earlier, then you do 2 core years of training and the specialty training for 5 years, and then depending what you want to achieve, can you take a job as a district general consultant, or you want to endeavor and get the specialist fellowship. Now, this portfolio pathway, which used to be known as Caesar, few of my very good friends, Mavish Nadeem, Rikaz Rahim, Adan Ahmed, and Khalid Hosni have worked very hard on these pathways, and they have make it very attractive and doable pathway for these guys. So this is another way of getting your specialist training recognized. Theoretically, anyone, even if you have FCPS, you can apply for it, but in real time, you have to have your FRCS Urol before you think about it. It's based on different aspects of training that you need to reflect and demonstrate. We call them capabilities in practice, based on outpatient, based on your emergency theater, elective theater, multidisciplinary approach, how you interact with the patient, your communication skills, and so forth. And everything has to have evidence for that. If you don't have evidence, you don't have it. So it is very doable, and GMC has a very good portfolio advice sheet on it. If you follow the scheme, you can do it. So, will I get a job? There's no point doing something which will not going to be successful as an outcome. So first of all, you need to know, will I get a job? Am I ready to get the job? Is it the right application I'm applying for? Is it the right post I'm applying for? That's why I always need Sake, Rana, we all are here to support you. But again, you have to prove you are really committed for it. You have to work for it. So in this cohort, I won't suggest anyone to apply for junior doctor's job. We know the workforce challenges have changed. Physician assistant and these different roles, because they are more cost effective. Trust can rely on them more. So I don't think so. Getting a job, if you have advertised one job, you get 500 to 1,000 applications. This is the reality at the moment. So I will not suggest anyone to apply for these jobs because it's a vicious cycle. You get depressed, disappointed. So that's why apply where your potential job is available.
So Mazhar, you have 4.5 minutes to explain to you.
So next is getting the trainee post, especially trainee post. I think if you're flying from here, the probability is very low. You have to be in UK and then you'll be eligible to fly. Then you have these other roles called specialist roles or locally employed doctors role, which have different name, but objective is the same. You basically are providing a service to the trust or hospital. But they can be a good avenue to start or initiate your journey in NHS. So there are plenty of jobs, get yourself. There are a few fellowships in, accredited fellowship and non-accredited fellowship. Again, applying from overseas can be tricky to get on unless you have a great portfolio or CV, ask for it. So I think if you need to have your facts right, you need to have your expectation correct. So as I mentioned about the different aspects of settling in UK based on your expectation, the College of Surgeons, the postgraduate training, publication, right job, right channels. Where do you want to see yourself in 5 years' time? That's a good question to have in your mind. Do you want to come back? If you want to come back, why are you moving? If you're working now as a consultant, chances of practice getting better in 5 years are higher. Challenges are everywhere and globally, isn't it? It's UK, there are different challenges. Don't forget what happens in Hull recently. in New York, like there were anti-Semitism, there are challenges everywhere. Just a brief outlook about, I've been running this Blackball Urology FRCS course for the non-trainee, especially for those groups, because I feel there's a significant difference in the pass percentage between non-trainee and trainee. And the reflection I get or the feedback that's very overwhelming. We provide this course free of charge, and we've been doing it for 3 years. We get international and local experts in the morning. We have lectures in the afternoon. We do the mock vivas. So I was also involved in International British Urology. I conducted a big meeting. Professor Ian Pierce, who is now the Vice President, is very proactive in supporting. So I love pictures. Everyone knows that. So this is another Abdul Rauf. He was graduated from Pakistan, moved to Ireland. Then he contacted. He's a trainee ST7 now.
2 minutes.
So it's all doable. So as I tell everyone, there are 4 cohorts of juniors who want, or people from urology, and especially wants to come back to go to UK. Very junior doctors, young trainees, post FCPS, and people who wants to relocate from Middle East, Kingdom of Saudi Arabia. The most common reason for them is either education or passport. We need to be factual about things, isn't it? Because, so in my conclusion, what I said to everyone, we have our own challenges, we need to have own aspiration. However, we all live once. Enjoy what you have. Content, qanaat is very good thing. Keep driving, striving is good, but at the same time, enjoy what you have. You don't know what's going to happen next day to you. So we should strive, but enjoy what we have. So this is me, and thank you very much for your attention.
Okay, thank you very much. We have 57 seconds, and let me tell you that this day, I've just been informed by Ayaz Khan, has been running very late, but not because of us, right? We started on time, we're going to finish on time. The AGM needs to be coming in here, so no more questions, no more comments. We're done. Thank you very much. And I just want to say thank you to the faculty, to the speakers. I want to thank